Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. Welcome to the Granite List Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace. And today we are joined by Anthony Hartley with MedAdvisor to dig into the bending of pharmacy spend. Anthony, thanks for being on today.
Thanks for having me, Sally.
Really excited about this discussion. So let's talk about what MedAdvisor does, why that work matters. And let's start, if you don't mind, really kind of talking about the autoimmune landscape, autoimmune conditions, and other chronic conditions that really do manage or mask symptoms in a way that employers may not be aware of or plan sponsors. So can you open by talking to us about that?
Yeah, definitely. I'll just give you a little bit of my background because this, I think, will give some context to why this area of science matters, how it helps patients, and of course also the plan sponsors. So this goes back a number of years where although I grew up in Atlanta, I spent many years working in Switzerland. And one of the best moments of that chapter was when I worked at a lab that was doing clinical trials for biotech and big pharma companies. So I was involved in a lot of protocols. There were a lot of studies. And what that meant was I got to see so much science and what might go from a compound, a concept, to eventually being approved as a medication or therapy. And a small fraction of the studies that stood out to me were those studies that was based on cell biology. So these were not medications per se, but they were more like the biologics that we see today that are often prescribed for autoimmune. And so what we decided is there's so much of this that's already being applied outside the United States. There must be a way that we can get more of these cell therapies to the patients that would most benefit. And what we found so far is that it's the self-funded employers and their employees that are in a position to do the right thing for their patients.
So Anthony, when we look at an employer's plan, studies show or statistics show that about 50% of pharmacy spend for an employer does come from these autoimmune conditions and chronic conditions. And I know we're going to dig into this a little bit further, but cell therapies are proven to help patients get better outcomes at lower cost to the plan. Why do you think these innovations aren't widespread yet?
I'm so glad you asked that question because just in the last couple of weeks, we saw more and more examples of why that's the case. So if we look at the major players, and maybe I shouldn't mention their name, but I can mention their medications. Some of these now have biosimilars. So for instance, there's now a biosimilar for Humira. There's now a biosimilar for Stelara. And that's positive for patients because it means they can get a similar outcome at a much lower cost. However, those medications still have side effects. Not all of the people get the same side effects. And one of the things that we continue to see, and just recently there's two examples that come to mind. I think what happens is that there's a lot of vested interest in the healthcare system. So sometimes when I joke with people like yourself and others in the community, it seems like we're part of a rebel alliance. And what I mean by that, and I'm paraphrasing Marshall Allen when he spoke once at a keynote, and I think what happens, and I think others will agree, including our medical advisor, what happens is these vested interests, they have so much influence over what information is made available to the public and what is made aware to plan sponsors and others. So I'll give you two examples that are recent. Now, one of them, we've seen it over and over. In this case, it was a celebrity, and I won't mention her name, but everybody knows the name immediately. The celebrity went outside the country to a clinic to get stem cell therapy for her shoulder. Now, almost as soon as we learned about this, there were multiple publications that were discrediting her, saying bad things about the clinic, being heavily critical of the doctor, but the patient did get a better health outcome. But they often use the same kind of wordings in that kind of article and others saying, oh, this is unproven, this is illegal, this is experimental. And yet there's a lot of science. There's so much data that we can show to patients like that one and others and plan sponsors so they understand that this is what you can see from the science. You know, that's what clinical trials are for, is is to prove that it can work in patients, first that they're safe and effective, and eventually they're efficacious. Now, here's a more recent one, and this one I found was really quite fascinating because sometimes you don't get to see the data until much later, and it has to do with the condition of the patient. Well, here was a study that was done in California going back in 2021 and 2022. Now, this study was for pregnant women, and it looked like the unborn child was going to be born with spina bifida, which is a neurological condition that could leave those children paralyzed at the point of birth, right? So that's a horrible situation. Well, in this study, which is really promising and very encouraging for anyone who's going to be a parent and those who are parents, what ended up happening is they did a surgery where they used the stem cells from the placenta. All the babies in the study were born without any side effects, without any issues. They're all healthy. Whereas if this hadn't been done, it would be in a totally different situation for those families. So what's interesting is to see, well, we were looking, okay, the information about that study, it was published in one of the British medical journals, The Lancet, and we were looking over the last week, okay, where else is this going to appear? How will people know about this? And here's the part which is curious. We have yet to see a major TV channel here or a major newspaper mention this study. And as people have commented to us, and also the people that are related to in the families, they said, this is a miracle. This is amazing. This is life-changing. And more recently, although we didn't see any major TV channel here or newspaper mention it, it appears in a segment in a channel called Sky News. So if you're in the UK or in other places that are often watching BBC, the next channel that people might often see is Sky News. So they did a segment on this. So you get to see the family, you get to see the pediatric surgeon who leads the study, but we have yet to see anything about it here. So it makes us wonder, well, something this positive, it's not articulated to the public. So that's a big part of the challenge, unfortunately, is that we are up against, I think, vested interests that have a lot of influence, and it's getting the opportunity to show that data to the right people. Sometimes that's really difficult if what they hear often is something that makes them think that, oh, well, we shouldn't counter this, or this is too early, or it's experimental, or these other adjectives they like to use. I know that's a long answer to the question, but I think that's one of the biggest obstacles for us and the patients that could most benefit.
Sure. And you and I have talked about this before. You didn't allude to it just now, but we also know that a lot of the traditional deliveries, methods, medications also don't have proven outcomes or effective outcomes, even though they're on the market. But for the audience, can we take a step back and really, when you look at the high cost claimants within a plan, kind of that 20% or less driving 80% of the cost, I think you all are seeing that high cost claimants with autoimmune diseases are impacting the plan in a disproportionate way to those with chronic conditions, which, I think a lot of times chronic conditions get the spotlight. So for people listening, can you give some examples of the types of autoimmune diseases you all are looking at or paying attention to?
Yeah, definitely. I mean, one of the things that we do is we'll analyze the claims data, and we continue to see autoimmune conditions that are impacting those patients directly, of course, and the pharmacy spend. And the ones that often are there are Enbrel, which can be for various autoimmune conditions, Humira, and then Stelara. And so the autoimmune conditions that most frequently are appearing are multiple sclerosis, rheumatoid arthritis, Crohn's, and there's other ones. And another challenge that we'll see as it relates to this is just the obstacle for the patient, how long it takes for them, he or she, to get that first appointment with a rheumatologist once they get a diagnosis. So that's another part of the challenge. But going back to the key part of your question, this is what is often appearing in the pharmacy spend as it relates to these kind of medications, which, yes, they're often 80,000, 100,000 a year. So they are often the high-cost claimants. It doesn't mean that they're all of them, but certainly when you look at that and the other pharmacy spend, it's often going to be those patients and patients with cancer and a handful of other ones. So just being able to address that in a better way based on the science, can lead to definitely a better health outcome for the patient and savings for the employer.
So I'm imagining that most plan sponsors obviously have a standard PBM, pharmacy program in place. How does what MedAdvisor deliver, how does it differ from the standard PBM?
I think what happens is that usually they'll have a TPA that's going to be helping them with getting those kind of medications to those patients. And a lot of times what we'll see is that the rheumatologist is going to prescribe what he or she usually prescribes. And this isn't necessarily offered to all the patients that could most benefit. So the challenge has been to engage with more TPAs and the rheumatologist to allow or basically help those patients to know that, okay, there's another option. And so much of what we do is the care navigation, because otherwise the patients wouldn't necessarily know about these type of treatments and the clinics where they can get the treatments. Now, one of the things that's interesting is, as you and the audience can appreciate, a lot of times one of the challenges is that the same physicians, they might know what's best for the patient, but they're an employee of an institution. And so they might not be able to give that kind of advice or say, oh, you can do this. So I'll give you one particular anecdote. So there was a rheumatologist that wanted to do the usual for the patient. And in the end, we helped that patient go to a clinic where they could get a cell therapy. And the rheumatologist was surprised, and the rheumatologist would usually prescribe the medications for the patients, like the ones I've mentioned. But then when it came to the family member, that same rheumatologist, well, they looked into this to help their family member to go to that type of clinic to get the treatment. So this is an example where, unfortunately, the rheumatologist, their hands were tied, you could say. They were limited in terms of what they can do. And this is unfortunate for them and for the patient. So as we've seen so much in DPC and healthcare in general, part of the challenge is that the physicians can't practice medicine as freely as they would like to. They can't be independent because they're an employee. And that's nothing on them. It's really just part of the challenges in the system. So where we end up seeing the best results is when the physicians can be independent, when they've gotten to the point where they are no longer an employee and they can practice at the top of their license.
Mm-hmm. Absolutely. And MedAdvisor helps navigate through that process.
Yes.
So you've touched on this a bit already. Obviously, this is a perfect solution for self-funded employers who are looking to take ownership of their risk and control costs. So how can employers benefit from these cell therapies? And how do they?
Yeah, so this is what we do is we first analyze the claims data. Of course, we can't do anything about something that's happened, but looking at data from 12 months ago, 24 months ago, we can help predict where things could be going in the future. And so there's a lot of education we do for the employer and the employees, and we do the care navigation so those employees can get to those clinics. Now, one of the things that is not presented clearly to both the plan sponsor and the employees is the difference that can happen if they continue to be on, let's say, Enbrel for many years. The cost over several years is a significant amount of money. And very much like the other medications in the space, which are the ones that are most prescribed, yes, they've received approval. However, like so many other medications, they'll mask the symptoms. To some degree, the patient might not get worse, but it doesn't lead to remission or reversal of disease. However, with the cell therapies, what happens for most patients, there's no side effects, which people find hard to believe, but again, we can show the data. There's no side effects, and what ends up happening is their health outcome does improve. And so the patients, once their health outcome improves, they start to go off on the medications. They no longer need those medications. And we've seen multiple patients where they get the cell therapy, and I'm thinking of examples like patients with multiple sclerosis, rheumatoid arthritis. They'll get the cell therapy. The positive effect might not be immediate, but it usually can be seen for that patient within weeks and maybe months. They eventually go off the medication. So for the next several years from that point, they're not taking those medications anymore because they don't need to. And that's where there's the big challenge, because you have certain entities that they want to continue to generate huge amounts of revenue by always having these prescriptions going on for years and years. Whereas in some ways, I could say that this is a one-time treatment. It could be as simple as 1 or 2 clinic visits. And then that patient might be well for many years before maybe they might have to do the treatment again, because it isn't a cure. However, it has advantages over the treatments that are most often prescribed. So from the patient's point of view, there's a better health outcome. Their quality of life can continue better than before. And then the plan sponsor, well, when you look at it as, okay, how much would you be spending over the next 3 years for this medication versus this one-time treatment, there's a huge amount of savings that can happen just with one high-cost claimant.
Absolutely. So we've touched on outcomes. We've touched on the data. We've certainly touched on the financial impact that it has for plan sponsors. Any closing thoughts you have to share with self-funded employers and that are looking into this area?
Yeah, I think what happens is there's so much that's presented to plan sponsors, and it's difficult to be able to, distinguish between the signal and the noise. There's so much that's going on that's trying to get our attention. And this is one of those areas where, we've seen it in other areas of healthcare where we have some entities that engage in what we would call anti-competitive practices. Hopefully that's improving. We already see initiatives and potential policy changes that can make things better for patients and plan sponsors. And I think what we would ask them to do is, this is not an area of science. This is not a type of treatment that is new. It's something that's been around for many years. It's been evolving over time. And if I can paraphrase a clinician we all know, in a way, it's like AI. It's been around for decades. It continues to evolve. And unless you're one of these patients that's gotten this treatment, you haven't had that dramatic, eye-opening experience like the first time we used ChatGPT and we realized, AI is no longer on the surface. It's here and it's impacting people directly in a profound way. And so when it comes to these therapies, there's so many clinical trials, there's so much scientific data, and it's basically what we're asking is, okay, let's set aside some time to look at this so you can understand this is something where there's so much science to support this, and yet what's often presented to the plan sponsor might be, maybe it's a medication that's approved, usually it is, but the data might not be very strong. Sometimes there's some tricks that can happen, and I can tell you a lot about that. That will take a lot more time, but from my experience in clinical trials, sometimes those studies are designed by some of these vested interests that, okay, yes, it's going to lead to approval, but it's not going to lead to the health outcome that I think most patients desire. And so it's really asking, okay, take a little bit more time to look at this data, and we can help with that, because this is not some area of science that's going away. It continues to evolve. There's more studies that are coming out. There's more recent approvals. I could talk about that at length as well. But there's just so much that isn't presented, and most doctors will agree, I think. There's so much science that isn't presented to everybody that could benefit. And sometimes that's just a question of, okay, well, who's controlling the medium? So it makes it challenging for people to see that this is something that is going to continue to impact patients in a profound way, but we won't hear about it on the news necessarily, which is a shame.
Well, and that's why we're so proud at the Granite List to feature your story and share it. We're very grateful for our partnership with MedAdvisor. And so for the audience listening, you can learn more about MedAdvisor at thegranitelist.com, as well as at medadvisor.co. And Anthony, thank you so much for being on another episode of the Granite List Live.
For listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.